So, hi, my name is Abby Lovatt. I'm a paediatric clinical psychologist, and that means that I work with babies and children with health conditions and their families. Um, Often people ask me what I do in my work. It can be quite hard to describe. I work with families where the baby or child has a different health condition, and my work is helping the whole family to adjust to life with that health condition. That might be helping them with their symptoms, with their feelings about that, and with their treatments, going to medical appointments, procedures, hospital stays, those kinds of things. The thing I love most about my job is meeting so many different people, new people all the time, children, young people, parents, and lots of different professionals as well. So I think I always knew that I wanted to work with children from quite a young age. And I spent some time in hospital and I decided that I wanted to be a doctor. But actually, when I started A-level psychology, I really loved it, and at that point I switched from a pathway into going into medicine where I'd wanted to be a paediatrician to wanting to be a psychologist. Thinking about what I was like at school, I was quite academic, but I maybe wasn't as focused as I should have been on my studies. I didn't do too well in my A-levels, but I did just about well enough to go to university and study psychology. And I knew that I needed to work a little bit harder there if I really wanted to go down that pathway. And when I really realised I wanted to be a clinical psychologist was after I'd done my psychology degree. I started a job as an assistant psychologist, working with children with mental health difficulties. And I had the opportunity to go and work in a hospital in paediatric psychology. And I thought, this is what I want to do eventually. I talked about liking working with children. My very first work was babysitting. I was a nanny for children. I did any type of job I could really. So working and caring for children, summer camps. I had a summer in America working with children from complex backgrounds. And I also taught A-level psychology in a college for a year. And I then went on to do some further study. So I did a master's in child development, went and studied in London for a while, and then I had some roles in research, and I finally got an assistant psychology post working in child and adolescent mental health, and I did that for a couple of years, and then had a place on the doctorate in clinical psychology course. So I waited to apply for that until I really knew what the job of the clinical psychologist actually was. It took about 10 years from finishing school to qualifying as a doctorate in clinical psychology. So yeah, quite a long path, but lots of different parts to it and very interesting. Lots of hard work, but well worth it. A typical day for a psychologist, every day is so different. It's hard to think about a typical day. I might be spending the day in the hospital. I might be out in the community. I might be doing a home visit or a school visit, or I might be seeing children and their families in our psychology clinic room, which is a bit like a playroom, but it's also quite relaxing for teenagers. I have two different parts to my job. One part of my job is working with babies who've been born too early or are not well when they're born, and they stay in hospital on a neonatal unit, and they could be in hospital with their parents for weeks or even months. I also work with children who have a different diagnosis, a different health condition. And the type of work involves helping the child, the parents, the rest of the family, all the people that look after that child in their life to help cope with life alongside their health condition. So thinking about their well-being, their feelings, their behaviour, helping their medical team to understand them and work with them, and helping them to live a good quality life. If I had to bust one myth about my work, it's that as a psychologist, we are not reading people's minds. The way I describe it to people is it's a bit like putting a puzzle together. Each piece of information I learn about a child and their family is like another piece of the puzzle. We don't need to have all of the pieces of the puzzle to build up a picture, but we need enough to build up a picture of what's happening for that person. I think that the tools of the trade of a psychologist are thinking and talking. So I think those types of qualities and skills are fairly important. And when we talk about thinking, it's being able to take your time, not make judgments about people, think really widely about what might be happening in somebody's life, and perhaps an area that might need to develop for some people is the confidence in meeting new people, and being out there in lots of different settings, meeting different people and having people maybe rely on you for an answer sometimes that you might not have. If I was asked if there were things that I wasn't good at to begin with but got better over time, I think the one thing for me is doing teaching and training. That's part of the job as a psychologist, and something that I feel a bit nervous standing up in front of a big audience, but sometimes I have to do it, and actually I really enjoy it when I do it. So I'd say I've hopefully got a bit better at that over time. If someone said to me that they think they're not clever enough to do the work, it's about having passion for what you're doing and really wanting to help people. And yes, there is quite a lot of studying involved, but I really enjoyed it. It's all really interesting stuff. So I think if you're really interested in psychology and you enjoy doing it, I think that can really help you do well in your studies. One of my favourite parts of my job is that I get to work alongside lots of other people. Because I work with children with health problems, I work with a lot of medical teams. I get to work with doctors and nurses and physiotherapists and occupational therapists, and I've learned a lot about what all of those people do and how they help children and how we can all work together. And part of my work is helping them in their understanding of children and families and how they're sort of coping. The kinds of people that are needed in this field, I think we need people from all walks of life, because what we want is psychologists that represent the whole population. So we need women and men. We need people from all different kinds of ethnic backgrounds, who've grown up in lots of different social situations and different family setups. I think that really helps in our understanding of people and how we can help them. I would suggest that they do some reading, learn a lot about the different types of jobs that a psychologist can do. It's quite difficult to get work experience when you're younger in working in psychology, but it's not difficult to get in touch with people and talk to them about their work. So I think if there's a particular field you're interested in, try and reach out, try and have a visit with someone, chat with someone about their work to really find out what's happening, and have a really good look at what the study pathway is, so that you are directed the right way if you're going to go to university, that you are choosing the right degree so that you can do what you think you want to do later on. Another piece of advice I'd give if you're thinking about a career in psychology is any work with people that you can do is helpful work. Being with people, talking with people, it might be working in a business, it might be working in a shop, it might be working in a cafe, it might be working caring for people. It's all work with people, and it's all work that you can have as experience. Volunteer, put yourself out there. If I could go back and give my 16-year-old self one piece of advice, what would it be? To take my time in making the decision in what I wanted to do. I think at 16, I thought I wanted to be a paediatrician and worked in medicine, and I was absolutely sure about that. And then something happened to change it. So keep an open mind about what you might like to do. I would say the best thing about working in the psychological professions is that no day looks the same, and that makes the job really interesting, and I look forward to going to work, and I think that's really important. You spend a lot of time at work, it's good to do something you enjoy doing. So yeah, I think if you think that this role could be for you, then find out more.